An introduction to Wisconsin Medicaid. Medicaid is a joint federal and state benefit program that provides health and wellness-related benefits for certain individuals. Medicaid is a complex program. This webcast is intended to be informational only and provide a basic introduction to the various Medicaid services available in Wisconsin and basic eligibility criteria. There are many different types of Medicaid programs in Wisconsin. For example, Medicaid provides benefits such as health care coverage, long-term care coverage, in-home care services, financial assistance with Medicare expenses, and even certain transportation services. Medicaid is run by the Wisconsin Department of Health Services. People can apply for Medicaid services online, or if you need help, you can go to your local county human services office. Medicaid is sometimes referred to as medical assistance or MA. There are many different types of programs under the umbrella of Medicaid in Wisconsin, and many different ways to become eligible for Medicaid benefits. Basic medical coverage Medicaid is sometimes referred to as card services Medicaid, because if eligible, you obtain a Wisconsin Forward Health Card. This program operates like private health insurance, allowing beneficiaries to visit participating physicians to receive health care services covered through the program's contract. In addition to basic health care coverage, there are also Wisconsin Medicaid programs that are considered long-term care benefit programs for both individuals in institutions and those living in the community. The long-term care Medicaid programs for individuals that live in the community are called waiver programs and include programs such as COP, KIP, IRIS, and Family Care. These programs provide in-home assistance to beneficiaries from different sources depending on the specific program available in your county. In addition to waiver programs, there is also a long-term care Medicaid benefit available for individuals that are in long-term care facilities such as nursing homes. There are also Medicaid benefits specifically for older adults that are also on Medicare. These individuals are sometimes called dual eligibles, and they can receive help with their Medicare premiums, co-pays, and deductibles through a Medicare savings program. The type of program a person is eligible for depends on their income. In addition, adults with a disability determination may also be able to qualify for Medicaid benefits through the Medicaid Purchase Plan, or MAP. This program has higher income and asset limits and is intended for individuals with a disability who wish to work but also need to remain eligible for Medicaid. There are also special Medicaid programs just for women with a cancer diagnosis and those diagnosed with tuberculosis, end-stage renal disease, hemophilia, and adult cystic fibrosis. Those were just some of the examples of many various Medicaid programs in Wisconsin. There are many more options, each with individual eligibility criteria. For the remainder of this webcast, we will discuss Medicaid eligibility in general, without getting into the specifics of each program. Medicaid is a needs-based program, meaning that in order to receive the benefit, the individual needs to be found eligible. Medicaid eligibility is broken down into 3 categories. The first is Medicaid for individuals over age 65. The second is for Medicaid for individuals that are permanently blind or are determined to have a disability. And the third is Medicaid for individuals that are very low income. Individuals that are eligible for Medicaid because they are either over age 65 or have a disability determination must also meet financial eligibility guidelines. This means that the person or couple must have income under a certain limit, which may change annually, and they must have assets under a specific maximum, typically no more than $2,000 for an individual and $3,000 for a couple. Some Medicaid programs, such as the MAP program, have higher asset limits. Please note, however, that regardless of the asset limit of the specific program, all Medicaid programs use the same definition of the term assets. The term assets refers to all the property owned by the Medicaid applicant or beneficiary. This can include cash on hand, money saved in banks, and stocks and bonds owned. It also refers to all the real property a person owns, such as vehicles and homes. Not all assets are considered countable assets towards the Medicaid program maximum. There are certain things called exempt assets, meaning that they are not counted for Medicaid eligibility purposes. Examples of exempt assets are a person's home, one car, personal possessions such as clothes and furniture, certain prepaid funeral expenses, and assets set aside in a WISPAC special needs trust, just to name a few. If taking away all of the exempt assets and adding together all of the other countable assets, the person is under the asset maximum, then they meet the asset prong of Medicaid financial eligibility. Please note that a person cannot give away assets in order to become eligible for Medicaid. This is called a divestment and will delay the start of a Medicaid benefit. Secondly, a person applying for Medicaid needs to have income under a certain limit, depending on the program they are applying for. Income limits are tied to the federal poverty rate, which changes each year. People who are eligible for SSI are automatically eligible for Medicaid based on their income. Other individuals may be deemed categorically needy and may become eligible for Medicaid based on their income and housing costs, and others are eligible for something called the Medicaid deductible program. These programs can be confusing and the eligibility guidelines do frequently change. So for more guidance, we encourage you to contact your local county Human Services office for assistance. In addition to Medicaid intended for individuals that are over age 65 or have a disability, there is also a Medicaid health care benefit for individuals who are very low income. This is called the Badger Care program. It is open to any individual between the ages of 19 and 64 that has income under 100% of the federal poverty line, which changes annually. In 2014, this amount is $972.50 per month for an individual and $1,310.83 for a couple. Children and pregnant women may have income up to 300% of the federal poverty line. There is no asset limit for Badger Care and no requirement that the beneficiary be disabled. There are special rules for families with regards to counting income, so again, we encourage you to contact your county's Human Services office for more information. Some long-term care Medicaid benefits, such as the Family Care Program and Nursing Home Medicaid, may require a beneficiary to repay the state from their estate after they pass away. This is called estate recovery and is a very complex process that has different rules for individuals and married couples. We will not get into the specifics of this issue today. For more information, please contact your county's Human Services office or local benefits specialist. It is very important to note that all Medicaid programs have very strict reporting rules. This means that if you have any changes in your income or assets, you need to inform your county about these changes, as they may affect your eligibility for benefits. If you are ever deemed ineligible for services and you had been receiving services in error, you may be charged an overpayment and have to repay the state. Wisconsin Medicaid is a complex program that has many different eligibility rules and many different benefits. This discussion was intended to be informational only and provide a very basic introduction to the topic of Medicaid and the various programs available.